Hi, I'm Dr. Prakruthi, one of the consultants among WMN group of doctors. Would like to give you information on importance of scans in pregnancy. Scans or ultrasound of fetus forms the most essential part of pregnancy care, which helps us to know the growth and development of the babies. When it comes to ultrasound, many people will have many questions or doubts with regards to safety of the scans, or if so, when and how many scans to be done. When it comes to safety of the ultrasound machine just uses the sound waves to produce the image of the baby, which is absolutely safe and harmless to the babies. And now regarding when and how many scans to be done. Minimum 3 to 4 scans are done in low risk pregnancy. The earliest scan is done around 6 to 7 weeks of pregnancy, roughly, which is about 20 days from your missed cycle. The purpose of the scan is to locate the pregnancy, whether it is there in the uterus or outside the uterus, which is called as ectopic, which can be dangerous. Second thing, to see whether you have one or more than one baby, to make sure the baby is growing adequately as required, and to check whether the baby has got its fetal heart rate. We also look for any other structural problems arising from the uterus or outside the uterus, which can be causing pressure effects on the babies. The next scan comes around third month of your pregnancy, that is between 11 to 13 plus 6 weeks. This is also called as an NT scan or nuchal transfluency scan, which is a very time-bound scan. The three things we look for: the development of the baby from head to toe, where 80% of the structural problems can be detected here itself. Second thing is we look for the skin fold thickness below nape of the neck of the baby, which is one of the predictor for screening a Down syndrome. And the third thing is blood supply to the uterus, that is uterine artery resistance, which is again a predictor of hypertension in pregnancy. Many a times this scan comes along with some blood test which reads maternal hormones, which when combined together gives a risk scoring for Down syndrome, although this test is still not made universal. The next scan happens around 5 months of your pregnancy, that is between 18 to 22 weeks. This is called as Tifa, that is targeted imaging for fetal abnormality and commonly called as anomaly scan. This is mainly to rule out any congenital abnormalities, and we see the structure of the baby in little more details. And we also look for the length of the neck of the womb and the blood supply to the uterus. This is a very important scan. We offer you a growth scan around 34 to 36 weeks of pregnancy in order to make sure that the baby is growing adequately, the water around the baby is normal and has a good blood supply. Suppose there is a problem in the growth of the baby, or if the mother develops any complications like blood pressure or diabetes, or if there are twins, then you may require additional 2 to 3 scans. As many of you have a low risk pregnancy, usually you require these 3 to 4 scans at distinct periods. 3D and 4D scans are the still and moving images of the baby in a more natural and clear way. And we look at it when we suspect abnormalities so that we can look at it more clearly. And it's very important to do the scans from Fetal Medicine Specialist because they are trained in detecting any problems with the baby and managing it. I wish you all a very healthy and a joyful pregnancy.